Are you having back pain? You might be. If you're a golfer, it's more than likely that you're going to experience that at some point. Now, what are causes of back pain? I have another video for this, kind of going at what are common causes from the golf swing that lead to back issues in golfers. A lot of swing faults can lead to back issues, swing mechanics, but also a lot of it has to do with the mobility and the strength that you have already as a golfer. Now, if you don't have enough mobility or turn, if you will, in the hips, we're going to run into problems, okay? So if you aren't able to rotate your hip 45 degrees, which 45 degrees, if you think, if I was sitting on the box or on a chair where my feet are off a little bit, if you're not able to rotate the 45, we're running into problems. 90's here. 45 is where we need to be, minimally, to be able to turn well in our golf swing, which is directly related to back pain. So if we're not able to turn very well with that hip, we're gonna run into problems. And so understanding that a lot of back pain actually comes from the hips. Not all back pain, but a lot of it does. But something that could help you right here, especially if you're having pain kind of like if you're a right-handed golfer and you're having pain kind of on the right-sided low back, kind of in the hip a little bit, let's go ahead and take this lacrosse ball. Now, I want to say that this isn't medical advice. You need to get assessed because back pain can be the result of something else. And it's important to get that full picture and that full understanding as to how your body is moving and how it relates to you as to what treatment you need, okay? This isn't treatment, this is a suggestion, this is common. If we find the top of the hip bone right here, let's find that kind of meaty point, the muscle kind of in between the top of this hip bone and then the bone right here on the side of the hip. So you can kind of feel like that's bone and that's bone. We can take this lacrosse ball and we can lay on it on the ground or lay kind of against the wall into that muscle. Now, if it hurts, it really shouldn't. It should be sore, a little bit sore, but it shouldn't be like, oh my goodness, what is this muscle? It's called the gluteus medius in case you're curious. The gluteus medius often causes a lot of low back tension that people experience and kind of that catching sensation. However, that might not be what's going on with you. It might be a lot more things going into this that you need to get looked at. But staying there, kind of spending some time on that soft tissue is going to be important because those glutes, they go through a lot when you're in your swing. They help stabilize a lot of things in the body, help stabilize your posture, it helps stabilize you when you turn, and it goes through a lot of force when you swing. And for a lot of people, they're weak and they're not happy, and they will cause pain. Now, with that said, what do you need to do? You need to get assessed. You need to get looked at. You know, if you need to have clarity as to what the appropriate plan is or should be for you, directly related to your situation. Now, if you don't have a clear path as to like what you need to do, give us a call. We'll talk with you over the phone and try to give you that clear path. And if you're local, let's get you in here and let's get you back onto the course without pain, because the reality is that can happen no matter your age, okay? If you're young, if you're old. Back pain doesn't necessarily have to be something that keeps you out. It's common, but that doesn't mean it's normal. Just because everybody's having it doesn't mean that you necessarily have to have it. And so, take action and let's get this better.